Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hello and welcome back to the Sit and Stay podcast brought to you by RipsyTech. I am Parker Anderson, the RipsyTech product manager, and I'm always joined by the illustrious, famed, magnificent, and ever so kind Tom Tarshis, founder and CEO of RipsyTech. Hey, Tom.
Hey, Parker. I appreciate one of the words you said is in my sort of life mantra, which is the
Famed?
kind, be kind.
Oh.
Well, I don't know if the mantra was like, be famous, be famous. I'm not sure how mentally healthy that would be, but I don't actually think you've ever used the other two words in my mantra. So I will sort of leave that task to you because that would give you some new words for your adjective for me at the beginning as well.
Okay. Well, always learning new adjectives, always learning new things about mental health practices as well, because that is what this kind of that's what kind of podcast we run here at the Sit and Stay podcast. We love to discuss topics that will help keep your mental health practice healthy and successful. So we have a good episode planned.
We do, but Parker, I'm gonna flip the switch on you a little bit and let you know. Let's actually do the mental health business moment of the week first.
Whoa!
Because it happens to play in something that happened yesterday, but it plays into this topic we talked about doing a couple weeks ago.
Oh, okay. Plot twist. 63 episodes in, and here it is finally. All right, what you got?
All right. So mental health business moment of the week, as we've been adding some new providers to our nonprofit clinic. And part of this process, when you add a new provider, involves credentialing. And we actually got our new provider credentialed with 3 of our 4 in-network insurances in 60 days-ish total. We'll talk more about that, but in general, that's pretty good. But then for the 4th one, we had been receiving notices that, be ready. And then I was really excited when yesterday the DocuSign came saying, all right, I didn't read it clearly, but I thought this was the final step to sign, and then the new doctor would be credentialed. However, what it turns out is that 90 days was, we're ready to start your credentialing. And then several emails later, and I'm like, what does this mean? How much longer, etc. And then getting back that, it can actually now be 90 days, but we've just started the process. And I and other people are fairly outraged, as we actually have like 15 patients waiting with this insurance company to be seen. And
so was this a please wait 90 days to wait another 90 days?
Yes. And in my, almost 20 years, is that fair to say almost 20 when it's really like 18-ish? I don't know. But in my almost 20 years, this has never happened that something has actually taken where you're supposed to actually wait 6 months. And I was so sure of it because, as you know, I'm on this ACAP Government Affairs Committee, so I kind of keep an eye on legislation. And I knew we had passed legislation in 2024 around, hey, you're not allowed to take this long, and that there's a law for, if you're not credentialed within 90 days, people are considered conditionally credentialed and can start seeing your insurance patients through your insurance company. So
that's nice.
I was like, sure. Unfortunately, that law takes effect January 1st, 2026, which will be good for credentialing people starting 2026. But
in 2026,
man, we are trying to escalate and see what we can do, but it is maddening. Parker.
Yeah, understandable. Well, that sure is a mental health business moment if I ever heard one. Okay, so actually going into this, like I had a whole idea of what credentialing was, and then when I was kind of coming up with my questions, I realized I had no idea what credentialing was. So let's actually talk about it. You said a lot of things there that gave me enough context. I mean, granted, the experience of writing the questions gave me enough context, but you just said a lot of things that made me realize, okay, this is all pertaining to insurance. Is that a correct assumption?
Yeah, well, and that is a good point of clarification. So I think on some level, the general term credentialing means you go through a process in order to work or provide services for a specific company or agency. So, so for example, a smaller business, you may not have anything that you require employees to go through. For a mental health clinic, maybe your credentialing process is go get fingerprints, or we're going to check a couple of references. You could call that being credentialed to work at a job site. For larger companies, more than 50 employees, or, there's going to be some process to determine your eligibility to even work there.
Okay.
With the specific focus on insurance companies, yeah, the credentialing refers to, are you fully trained? Are you fully licensed? Have there been malpractice suits against you? There is sort of a standardized verification of education and licenses, and other legal requirements that you need to pass for the insurance company to say, okay, we will allow you to see our members. There is, we're calling this episode sort of credentialing. There is a second piece, which is once you're credentialed, there is still another step called contracting, where once an insurer says you're good to go to see our patients, then we have to say, okay, now add that person under our business so they can see your insurance patients under our clinic's contract. That piece tends to be easier and much shorter, but it is a second part to what goes into a provider being able to see patients.
Okay, so credentialing is something. See, this is where I got mixed up because I initially, I want to say for years, when I heard credentialing, I just thought that pertained to getting licensed, but that is a different thing. So in this case, you're already licensed at this point. You want to get a network with an insurance company, and therefore you need to get credentialed with them, but that does not necessarily automatically contract you with them. Or like, I guess if you are a group that is contracted with them and then you have somebody come in as a new provider, they need to be credentialed, and then from there you need to contract them under the entity.
Correct. And
Woof.
excuse me, there is a term called delegated credentialing, which is when you get to a certain size. For example, maybe you have 100 clinicians, and I was approaching this number with my old clinics when we were getting close to the 100 clinician mark. That then you can go to the insurance company and say, look, we have a lot of clinicians. We don't want to go through this process with you every time. And you make a deal with the insurance company, like, we've been providing good services. Here's what we'll check to determine that they're a good, safe, licensed provider. And then you figure out with the insurance company, you essentially get the power to do the credentialing yourself once you reach a certain size and make an agreement. And that's called delegated credentialing. That is a much better place to get to because you don't have to have this delay where you're, that you have no control over before someone can start.
Okay, what can you tell me about this acronym that I came across? I believe it's for an organization. It's CAQH, and how that fits into the credentialing process.
Yeah, so Council for Affordable and Quality Healthcare is CAQH. I do
Okay.
believe they're a nonprofit group. And well, while I'm talking, I'll let you Google when they were first formed. But this is the entity
1776.
that did a nice job of coming in at some point and saying, right, it used to be every insurance had their own 50 pages of forms that you sort of had to hand fill out. Then computers and technology started. Insurance companies still had separate, it was sort of like old college applications, and then now moving into like the standard college application. But they said, let us sort of standardize. We'll collect education, we'll collect legal history, we'll collect license numbers. And that is what this group does. So, and what year did they
Starting in
start?
1998.
1998. Yeah. So not that long ago, Parker, right? So
Not that
before
long ago.
1998, well, I doubt it took 6 months in 1990 to get credentialed, but yeah, so that's everyone knows. I shouldn't say everyone knows, but most people who do training in any type of institution that accepts insurance, so a lot of universities, a lot of masters in psychology training programs do have some affiliation with the entity that takes insurance. So sometimes from very early in your training, the university will ask you to complete a CAQH application, and that does help. That's sort of the first step, and that helps get the process started.
Okay, so by creating a profile with or filling an application with CAQH, you're not necessarily getting in network with these insurance companies, but it's like a profile that is kind of legitimizing you in the eyes of the insurance companies in a way.
Yeah, or it gets, a good list of standard information that everyone needs. Like, where was your undergrad? Where was professional school? What were your scores on your licensing exams? What state is your license in?
Oh.
When does it expire? What's your malpractice insurance number? What's the address of the places that you're working?
And is all of that information that the insurance company has access to,
Correct.
including the scores on your licensing exam?
Correct. Yeah. And
And could
so
that be used as leverage for rate negotiations?
uh,
I'm just thinking out loud.
that's, what, Parker, I love that thought process. That in we pull out everything we can in rate negotiations, and I wonder if you had some very high scoring, um,
Well, or
I'm
vice versa. Could they use it against you if you
as I'm
just passed?
thinking about the specific questions now, I'm not sure they collect the scores. It may just be the dates and whether you passed or not.
Gotcha.
But if you did have a clinic that had very high scores, why not throw that in there and try to
Right,
negotiate it up?
right.
But maybe that makes you a worse therapist, because if you're nerdy enough to get a very high score on a test, maybe your social skills aren't
Can't
great.
relate to human beings nearly as well.
But yeah, so you every
Uh-huh.
person gets the CAQH ID, which is almost like sort of like your NPI number. It's something that sticks with you, and so yeah, that is what
Okay.
CAQH is.
Okay, interesting. Okay, so is this something that you need to keep up to date, or is it just like something that stays the same?
You need, so right, so some things will stay the same, but other things like the address you work or the expiration of your license or malpractice certificate, those things do change. And so within CAQH, you get individual reminders, I think every 90 days, to go through and reattest that your information is up to date. And it will prompt you if something's expired to upload a new certificate or something to that extent. Um, and yeah, so it is something that needs to be kept up to date.
Okay, so you could make a mistake or forget to keep it up to date. Like, I guess, are there consequences to that?
Yeah, so this is It's such a great topic and question, but the reality is we're having humans fill in a lot of numbers and other information that is prone to typographical errors.
Right.
And, so there's a question around, and there are entities that will actually do a whole CAQH for the clinicians. They'll say, give us your papers or let us know information, and we'll actually enter it all for you. Because if there is an error on like, and this did happen, on when a license expires, and even on a ridiculous level, Parker, where if the license expires on September 30th and you put September 29th, it immediately gives an insurance company a reason to reject the credentialing and saying, the license you entered doesn't match what's on the state record, or the license date you entered doesn't match when we asked you again, even though we were going to get it, and then they're like, now it's rejected and you have to start the whole process over.
Ugh. No shortage of those things happening. Okay, so
Yeah, so this is
in,
that, in general, sorry, yeah, no, we, like, if you've got a busy clinic and you're promising these timelines for people to start and you need to get them credentialed, you sort of want to take that out of the clinician's hands.
Yeah.
Because it means a lot, there's just a different level of detail and experience.
Okay, so what if I am what if I'm credentialed and then I am contracted with these insurance companies, but then something needed to be updated on CAQH and I let it slide or I forgot? Is that going to impact my insurance contracts in any way?
Yeah, so once you're the biggest, time commitment is at the beginning and getting that initial credentialing and contracting. If something lapses that needs to be updated on CAQH, the bigger issue is that's going to be like your license or DEA or malpractice, which is less than about it not being updated on CAQH, but more that will alert the insurance company that something critical is expired and they will suspend you until you get it active. And that is actually helpful because you don't want to be practicing without an active license or malpractice or.
That is valid. Yeah, correct. Okay, so in terms of timeline, is that you talked about it in the mental health business moment, but is that like 90 days? Is that the typical time to wait? Or I guess in the case of your situation, waiting 90 days to wait 90 days, or with this new law that's coming into effect on January 1st of 2026, is it just like 90 days? Like that's how long I should expect the credentialing process to take? Is that the case?
Yeah, so in California, at least beginning next year, you could say, if everything is completed and there are no mistakes, you'll be good to go in 90 days. And that will be nice to actually tell potential employees that, yeah, definitely you can start right April 1st. Like, asterisk, who knows how hard it would be to like file a claim and say, no, you violated this law, you have to pay us, etc. In reality, actually, Parker, for getting this mental health business moment of this week, it often can be closer to 30 days or
Right.
60 days. I think the other variable that comes in is there are some insurance companies that, accept the CAQH and use a common system like Availity for their, for people to add new providers, and they don't send you 15 other pages of information to complete. And that can make the process very smooth and fast. the problem comes with like you have people do the CAQH form, and then some insurance companies send you another 15 pages, sometimes still handwritten, but they're like, okay, you need to log in and do this as well, and it's like, dude, I just did all this and you have access to it. But then other insurance things CAQH doesn't ask is like, do you have a specialty, and so what's your personal profile. So it's reasonable for other insurance companies to ask like for a paragraph on your bio or something not in there.
I see.
But it's maddening that so many ask for the same exact information that they have access to, and that creates another delay to like, hey, new clinician, you need to actually fill all this out also.
Okay, I have a couple of follow-up questions to some of the things that you said. So earlier you mentioned like, oh, April 1st, you can definitely start working that day. So is that kind of like a thing? Like if you are hiring somebody new, like you're hiring a new clinician, you would want to push their start date out as an employee to when they are confirmed credentialed?
Yeah, and this is, an important business move, and that I wasn't, something learned after a few years in is if you're a mainly insurance-based clinic, you have to have it in the contract that, our hope is that you'll be able to start by this date, but you cannot start until you're credentialed with and contracted with 3 of the 4 insurance companies we take, because otherwise you can't fill people's schedules. And
Right.
so, as soon as someone's eligible to be licensed, like the day after graduation, or for lots of specialties, you can actually apply ahead of time and be ready. But this is the big determinant in how fast you can start a new clinician. So I think, we had someone who, and lots of times after many years of training, taking a few months off is a good idea before you start your career. But we had someone who sort of signed a contract July 8th with a goal of starting in October, but then they actually wanted to start a month earlier. And it was sort of like, if the credentialing happens, then we're happy to do that. They were able to start sort of September 15th because we had gotten credentialed with 2 of the 4, and that was enough to get things rolling. But you want to, protect yourself against these delays that are out of your control that can happen, and not guarantee start dates if you're an insurance-based business.
Okay, this is making quite a lot of sense. This is actually not as complicated as I thought it would be. It sure sounds like a nuisance, especially if you have to wait 90 days to wait another 90 days. But I do want to circle all the way back to something that you said when you were talking about your mental health business moment of, you've got somebody, you're dealing with this 90 days nonsense. And you said you're thinking of escalating it or maybe making some kind of appeal. Like, are there things that you can do to try to speed the process up or at least avoid any kind of delay?
Well, so this is as the 90 days was approaching for this, whatever this mystery first step, I began emailing sort of on a regular basis, like, what's the status? And then literally a day, 2 days before this 90 days was up, we got that DocuSign that I thought was like, okay, you're credentialed, but no, this is, so that initial 90-day time frame they gave, was just around, getting the process started. So now that we've confirmed that, no, now is the real timer for the credentialing has started.
Right.
It's really just, someone could look at the information and probably say, good to go in 2 hours, right? Like this isn't, all this stuff is publicly available. I don't know what they're doing. Like, you can verify licenses quickly. Um, there's probably a backup because it's not in insurance companies' interests to credential people very quickly, because then more people will use, here, cynical Tom, sorry, more people will use their insurance, and that hurts the insurance company's bottom line. So, if you're going to cut employees, but now we can be a little social justicey and like, you've got to be kidding me. 180 days is ridiculous. There is a law in California about to be implemented on this topic. And I sort of did the like gentle escalation with, we have a lot of your patients waiting to be seen. Is there some way we can speed up this process? Or can we get a streamlined process for single case agreements for your patients, knowing that someone will be in network soon? And so that was step one of the escalation. We'll see how they respond. It is this, and then I'm not the executive director, so the executive director could get involved. It is that this legislation was passed in California for a reason. That doesn't mean we can't still go to the make a complaint about this insurance company to the California Insurance Commission with the data of, here are kids suffering with mental health issues, and we have someone who could see them, but this company is trying to delay that for 6 months. Anyway, right. It's a deciding which tact you're going to go around conversations is a several podcast series episode we could do, but we'll see. We'll keep people posted.
Okay, the first wave escalation tactic has been launched, and phase 2 is pending, if there is a phase 2. Okay, so let's see. You're credentialed, you get contracted. What's next? Is there anything else left to do? Is there any kind of maintenance or compliance that you need to stick with to make sure that everything stays kosher and good?
Yeah, no, I think it's, if you're going to let your clinicians be in charge of their CAQH, which is probably, how it should be, then you just want to, make sure they're compliant with keeping their license, for doctors, their DEA, stuff that you can't really do for them because they need to sign, right. Add their signature. If there are things that, malpractice, you get a new certificate each year. So when people need to upload their new certificates. And so you can make sure to remind your employees of that and follow that piece up. There is a way to sort of register your group through CAQH, which we've done, but ultimately that still is linked to people's individual CAQH profiles. But in general, once you're good to go, it's not too hard to sort of keep the few things that expire up to date. But yeah, so
yeah, I guess beyond what we've talked about, like, is there anything else more to it? Any other tips and tricks of the trade? Yeah, I don't know. Any other thoughts?
Yeah, I mean, there is some, lots of times people have multiple addresses that they're working at. Well, and actually this is a good question, Parker, right? Because
yeah.
When you're listing your locations, there are 3 locations for sort of every site. There's like, where is the practice located? And then there is like, where is the billing team located? And then where is the corporation located? So lots of times that could be the same address for all 3. However, it could be 3 different addresses, or it's often 2 if there's a headquarters, right? If we're opening a new clinic in San Mateo and our headquarters are in Berkeley, all of a sudden that's a different address. And you're asking like a new employee to enter that information on their CAQH.
Yeah.
That's where typos, errors, and other things can cause problems.
Yeah, so that's probably where like a really good onboarding instructions package for new employees, you know, when going to CAQH, make sure that you input these specific addresses in these specific fields can probably go a long way.
Yeah, so I've actually created, a Google form that force everyone to complete. I shouldn't say force that for new employees, they need to complete this Google form with all the information I know is on CAQH. And
So you
then
forced them, got it.
force them.
I hear you.
And then I think I can things have changed, right? So I can do a better job of, tricky spots to watch on CAQH. Make sure this address goes here and this address is here. And
Yeah.
ultimately, like screen sharing and or having someone do it for people, um, is a safe way to fix, ensure accuracy.
Right.
My eyes gazed off because every time you say GOOGLE, the phone is asking what it can do for me. And
Sounds like Android phone people problems.
fair enough. Fair enough.
um, I'm a proud what's the Apple what's one way ecosystem user. Okay, all this makes sense. I feel good. I feel like I've learned a lot, and I'm not even a clinician. I don't need this information, but hopefully the clinician listening feels, there's no, all the fog is gone. They know exactly what they need to know. We've already done the mental health business moment for the week, so I think that's it. Anything else left that you'd like to say?
Yeah, no, I do think it's for people who are self-pay or cash practice only. I do think this is still a good exercise to do a
That's a good
CAQH.
point. Yeah. So it's just
Especially
not something you need to do at all if you accept cash.
correct.
Very, very interesting.
But
Very interesting.
to prep yourself when, thanks to our advice from this podcast and with RipsyTech's help, you've got that killer fair reimbursement insurance deal, and Ripsy's going to do all your billing, so it's no headache. You want to have that CAQH ready.
Well, when you say Ripsy's going to do all your billing, what could you operationalize that for the user or for the listener?
Yeah, for a lot of people, I don't think it's the main reason. I think the main reason is poor reimbursement rates, but a secondary reason is dealing with insurance billing and hassles a lot of people don't want to deal with. So let the experts do it.
Reason for what? Oh, okay. You're getting there.
Yeah,
Continue.
yeah. Let the experts do it for a nominal fee, and keep that, enjoy the benefits of having unlimited patients with insurance, be ringing up your phone, and not have to worry about the hassles of getting paid. We will make sure that happens for you.
Is this a RipsyTech ad?
It is. So I would, we occasionally throw in quick 1 or 2 line RipsyTech ads, but we can do it a little bit more on this one.
We probably could. I mean, we like to keep the podcast useful. We like to keep the software working great and having our users happy and also our listeners happy. But if our listeners ever wanted to be our users, I'm not going to stop them. So, yes, we have a great billing system. I suppose when you say do all of it, do you mean like some kind of special offer that we're giving that maybe you want us to talk about? Or?
Yeah, I mean, and we have like 4 billing tiers, and there's, if you want to do the billing all on your own, it's like pennies for each claim submission, and you handle it. If you want us to do the claim submissions and then follow up with insurance companies if there's problems, that's another tier. And if you want us to go all the way to collect your patient copays, so we try to keep the lowest tier very reasonable, like 2.9%. It's hard saying that on a podcast because that can change with time. So this is sort of 2025 pricing. That's fair to say. But yeah, for most people, right, if you're bringing in 20 grand from insurance claims each month, that's only $500, right? $500, which if you think about the time it would take you, that's probably money well spent. You could see another patient or two and cover that. But yeah, so we work. Insurance is complicated. The credentialing is complicated. We do our best to try to make it easy. Even so, there is a limit to how easy you can make a complicated mess like the American healthcare system. But we will keep striving to improve.
All right, I brought that up because it's not that offer is not something that is currently on our website as like hey, this is something that we do quite yet, but it is something that we have started implementing with a handful of customers that we have an existing relationship with and have spoken with. But yeah, okay. Perhaps more to find out on that later, or if you're interested in that, shoot us an email at sitandstay@ripsytech.com.
Yeah. Many more podcasts we could do on the billing system, but it's kind of boring. We gotta spice it up a little.
All right. Well, let's put a cap on this one. I'm gonna go ahead and say it. That's it for this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. If you enjoyed the episode, we do love a good rating or review wherever you are listening. I'm talking Apple Podcasts, Spotify, YouTube. Those are all the big ones. But, wherever you're listening, if there's a rating system or a follow button, subscribe button, any of those things, a like button, hit it. It really goes a long way. And if you have gotten all the way this far into the episode, we would really appreciate it. So if you have any questions as well, if you want to get in touch, just shoot us an email, sitandstay@ripsytech.com. It goes to our inboxes, and we read every email that we get. So we love hearing from our listeners, and we love shouting out our listeners. So that's everything I have to say. All right, Tom, it's been great, and I'll see you next time.
Thanks, Parker.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.